endocrine physiology, cortisol. So first and foremost, we know that cortisol is going to be produced by the adrenal cortex at the zona fasciculata. Now, with cortisol, what we have to understand is its functions. There's multiple functions that cortisol has, and the first one is it increases blood pressure by upregulating alpha-1 receptors. It also has an increase in insulin resistance, so it's a diabetogenic type of hormone, and it increases gluconeogenesis, lipolysis, and proteolysis, leading to an increase in blood glucose levels. So this kind of works in favor of diabetes and against any insulin, right? Because it increases insulin resistance and it also increases blood glucose levels. Next thing that we have to know about the function of cortisol is that it's going to decrease fibroblast activity. So patients that have cortisol or increased levels of cortisol or are using steroids, which is just cortisol, they have poor wound healing because of the decrease in collagen synthesis, which is very important to understand. Lastly, and most importantly, cortisol, as well as any type of steroid usage, right, is going to lead to a decrease in inflammatory and immune responses because it inactivates NF-kappa beta, and it leads to an inhibition of leukotrienes and prostaglandins. So we get an overall decrease in inflammatory and immune responses. Number two, it also inhibits white blood cell adhesion. So what happens is we get neutrophilia. We have an increased amount of neutrophils within the blood because they can't get to the periphery. And that's a very important aspect of cortisol function. You also get eosinopenia, which is just a decrease in eosinophils, and lymphopenia, which is also a decrease in lymphocytes. Lastly, you're going to see a decrease in bone formation, which causes a decrease in osteoblast activity and an increase in osteoclast activity. So cortisol actually increases your risk for fractures in the elderly. So be careful when patients are using glucocorticoids or steroids that are elderly because it can increase their risk for fractures. One last thing, you could see reactivation of TB and candidiasis due to the fact that it blocks IL-2 production. And that's an important aspect as well. Overall, I think the inflammatory and immune response is very important for cortisol function. So make sure you understand that it decreases inflammation and the immune response and causes neutrophilia, as well as bone breaking, fractures. All right.